Welcome back to Ocular Vitas Med. For those who are new here, our guiding principle is precision vision, vibrant life. Today, I'm diving deep into an incredibly fascinating medical intersection where your body's hormones meet your eyes. I'll be talking about Thyroid Eye Disease, which is also known as Graves' Ophthalmopathy. If you're a clinician, a medical student, or simply a patient trying to understand why your eyes are changing, then this comprehensive breakdown is for you. But here's the twist that surprises a lot of people. Even though this condition is closely linked to an overactive thyroid, you don't actually have to have an overactive thyroid to get it. It can happen if your thyroid is sluggish or even if your hormone levels are completely normal. I'm going to explain exactly why a problem starting in your thyroid gland can turn into a vision-threatening emergency right inside your eye sockets. Also, I'll be explaining exactly how this happens, the warning signs to look out for, and the advanced treatments available. Firstly, to understand why this happens, we have to look deep inside the orbit, which is the bony socket that holds your eyeball. The eye socket is a very tight, confined space. It holds the eyeball itself, the 6 muscles that move the eye, the blood vessels, the nerves, and a specific amount of cushioning fat. So in thyroid eye disease, the primary target of the immune system's attack is a specific type of cell living in this tissue called an orbital fibroblast. Now, you might be wondering, why does the immune system attack these specific cells? It comes down to a case of mistaken identity. These cells behind your eye share the exact same receptors found on the cells inside your thyroid gland. So when a patient develops Graves' disease, their immune system creates confused antibodies. These antibodies travel through the blood and bind to the receptors behind the eye, turning them on just like kickstarting an engine. Once these cells are turned on, they cause 2 major problems. The first one is they produce massive amounts of a sugary fluid that acts like a sponge, drawing immense amounts of water into the eye sockets. The second problem is they actually create brand new fat cells, multiplying the tissue behind the eye. Because the bony walls of your eye sockets cannot expand, all this extra swelling and fat leaves the eye with nowhere to go but forward. Now, the physical signs. This crowding inside the tight socket leads directly to the classic structural signs of the disease. Let me break down the most common things you will notice. The first is eyelid retraction. This is when the upper eyelid sits abnormally high, exposing the white of the eye above the colored parts. This happens because inflammation and scarring damage the muscle that lifts the lid. So it creates a constant startled or starry appearance. The second is proptosis, which is the literal bulging forward of the eyeballs. So as the swollen muscles and fats build up pressure behind the eye, they physically push the globe outward. Because the eye is pushed forward and the lids are pulled back, patients can no longer blink effectively or even close their eyes fully while sleeping. And this causes exposure keratopathy, meaning that the delicate surface of the cornea dries out completely. This leads to a constant gritty feeling, severe redness, pain, and dangerous ulcers of the eye. The third sign is double vision. The muscles that move your eyes become intensely inflamed, swollen, and eventually turn into a rigid scar tissue. The muscles on the bottom of the eye is usually hit the hardest, and when it scars, it loses its stretch and tethers the eye down, so it prevents the patient from looking upward smoothly. Because the two eyes no longer align properly, the patient now sees double. Now, let's look at the most dangerous complication of this disease, the thyroid optic neuropathy. This happens in about 5% of cases, and it's a true medical emergency. To mention, the eye socket is shaped like a cone that tapers down to a very narrow point at the back. All your eye muscles actually start here, and the vital optic nerve passes right through this tiny opening to connect your eye to your brain. When those eye muscles swell to multiple times their normal size, they create a massive traffic jam at the very back of the socket. So they literally strangle the optic nerve and cut off its blood supply. For us to catch this compression before it causes permanent blindness, you have to watch for these key warning signals. The first is loss of color vision. Secondly, reduced visual acuity. Thirdly, pupil reflex change, and then loss of peripheral vision. Now, firstly, a loss of color vision. Often, this is the very first thing to fade when the nerve is squeezed, which determines how vibrant colors look. So, red objects, for example, will start to look washed out, gray, or even dull. Secondly, is a reduced visual acuity that can't even be corrected with a new glasses prescription. Thirdly, a change in how the pupils react to light during an eye examination. And fourthly, the gradual fading away of your peripheral vision, that is, your side vision. If any of these signs appear, immediate medical or surgical intervention is actually required to clear the traffic jam, to relieve the pressure, and then to save the patient's sight. Now, let's look at the phases and modern treatments. In managing this condition successfully, it requires understanding that the disease goes through two distinct phases, which doctors map out using something called Rondo's curve. The first phase is the active inflammatory phase. This typically lasts anywhere from 6 months to 2 years. During this time, the eyes are actively red, painful, and swelling. Medical treatments are heavily focused on stopping this active immune attack. The second phase is the inactive fibrotic phase. So once the inflammation naturally burns out, the disease stops changing. The eye is no longer red or actively swelling, but the structural damage is left behind. The swollen tissues have turned into stiff scar tissue, and at this stage, medications no longer work, and surgeries are definitely needed to fix the structural issues. In the active phase, high-dose intravenous steroids are traditionally used to calm the inflammation and reduce swelling. However, the modern frontier of treatment involves a targeted biologics, whereby a drug is designed to explicitly block the receptor behind the eye, which can dramatically reduce eye bulging and double vision without the heavy side effects of the traditional steroids. When the active phase is over and surgery is required to repair the damage, it must be done in a strict specific sequence. The first is the orbital decompression surgery. The second is the strabismus surgery, and the third is the eyelid surgery. So, thyroid eye disease is a powerful reminder of how intimately connected our internal health is to our vision. Managing it effectively requires a team effort between the endocrinologist and the eye specialists. By keeping thyroid levels stable, managing lifestyle factors like smoking, which drastically worsens this disease, and then using targeted treatment at the right time, we can protect both a patient's appearance and their sight. Thank you for watching on Ocular Vitas Med. If you found this helpful, please hit that like button. Leave your questions or experiences in the comments below and make sure to subscribe so you never miss a video. Remember, precision vision, vibrant life. I'm Dr. Vera and I'll see you in our next video. Bye.